Good morning. Thank you for joining and watching our first female athlete development workshop. I am Dr. Lauren Byrne, a physical therapist at Better with Physical Therapy. And today, my goal is to really just provide a little bit of information and education on the female athlete, why the female athlete is a different population, and what we can do to better improve their experience as athletes on and off the court. So the female athlete, for an overview, has become a much bigger target audience recently because there has been an increase in the amount of women in sports, and that is both at the professional level, at the Olympic level, and at the collegiate level. There has been about a 3-time increase in NCAA participation in female athletes since Title IX. There's been just a 40% increase in female athlete participation since the 1900s, 1990s. And women are expected to contribute over $1 billion in women's sports media value. What this means for our female athletes is that our youth athletes actually are impacted by this general push towards excellence in sports for women. Because they see all of this success from a younger age, there is more of a push to excel at their sport. And what that tends to lead to is specializing in one sport early on. And there's more pressure for them to actually perform at a higher level in order to achieve college scholarships or have a career in athletics, which can change the way that our training is targeted for these youth athletes. Now, this has been going on for many years, and male athletes have obviously experienced it first. So what is different about the female athlete, and why does this matter? Female athletes are not just the counterparts of male athletes. They are, in fact, different on multiple levels, especially because of many psychosocial factors that influence them, biomechanical factors, hormonal factors that actually increase the rate of injury for female athletes due to ligament laxity, due to changes in Q angle for women, which increases the risk of injuries at the knees, and a lot of psychosocial factors, including social, emotional, and environmental factors, impact not only how well they do in sport, but also how long they're willing to stay in the sport that they're participating in. For women, we do find that ACL injuries are 3 to 9 times more likely than they are in their male counterparts for the same sports throughout the lifespan. They're also 2 times more likely to experience stress fractures. They're more likely to experience concussions. All of these injury risks are influenced by those hormonal, biomechanical, and psychosocial factors. There's also neuromuscular factors, including the difference in our muscle imbalances in females versus males, our ability to accept load distribution. So that does increase the rate of injury in females. Now, what has been studied and what has been shown for years is something called the female athlete triad. So it's 3 interconnected conditions that is often seen in young female athletes. And that it's composed of disordered eating, reduced bone mineral density, and amenorrhea, which is an altered menstrual cycle. These 3 factors typically go together. Again, related back to that biopsychosocial model, it's not only based on structural and anatomical discrepancies in the body, but it also there is a component of low energy and availability for women. It can be purposeful or it can be inadvertent. And we will talk a little bit more about that later and how that low energy availability kind of starts in a female athlete and then the role it plays in their performance and in their participation in their sports. More research has been done recently on REDS, which is relative energy deficiency in sport. It is a multi-system condition. And as you can see in all these boxes here, it affects immunological, gastrointestinal, cardiovascular, psychological, growth and development, hematological, metabolic, and bone health. So a lot of categories kind of at play together. And a lot more research has been done to kind of evaluate relative energy deficiency in sports, both in female and male athletes, because it has become a more common finding. All of these factors play a role in your athlete's likelihood to have an injury, experience an injury. It also does result in a ceiling cap for athletes. If they are experiencing this at a level that is not truly pathological, where they get injured, they actually will experience a performance ceiling, which means they can only perform so well and up to a certain extent because their body doesn't have the energy availability to perform at peak capacity. Why this matters is because of the high prevalence of these experiences in youth female athletes. 45% of youth female athletes demonstrated low energy availability, and 63% were at increased risk for development of relative energy deficiency in sports. So it is a more common phenomenon than we realize, and there's not always a lot of education or information about it. How these deficiencies occur. So, as I mentioned before, with the female athlete triad, it can be purposeful or it can be inadvertent. What inadvertent means with low energy availability is that as our athletes start to exercise more, we actually have a point in exercise where it suppresses our appetite. So the athletes stop feeling immediate hunger when they hit a threshold of how much energy they're already exerting. Because of that, their appetite is actually not a good indicator of how much energy requirement they need and how much caloric intake they should have. Athletes and their families, especially at a young age, are not aware of the caloric intake they need. And there's not a lot of time spent discussing the nutrition breakdown of what they should be having to help fuel them. So, a lot of the times, this low energy availability is inadvertent and it can be avoided if the education is there. However, there is the other side of that spectrum where occasionally it can be purposeful. There is research that has found disordered eating is more common in aesthetic sports, including gymnastics, dance, figure skating. However, there also is a prevalence of it in aerobic sports, where athletes often falsely think that lighter might mean faster. So they want to lose weight in order to be better or quicker on the field or in any kind of competition. And a lot of the time, it does take education to learn that is not the case, that specifically lighter does not mean that we have more energy or more speed. And it is a combination of education as well as some of that psychosocial support in order to help athletes get through that purposeful restriction in calorie intake and understand that low energy availability will actually impede their success on and off the field. So, how Red-S can impact the whole person. This is not just a factor for the athlete on the field. While we do see that it decreases muscle strength, and it also reduces their training response, which means that as the training intensity gets higher, instead of them adapting to it, they actually decline or they plateau. So we do see those things that are related to sports and athletics. However, we also see irritability and depression increase, and we see poor concentration, which impacts their ability to focus in school, sometimes their performance in academics, because they don't have the energy availability for all of our other metabolic and endocrine processes to take over because our body is in a state of conservation. It wants to put all of our energy and all of our caloric intake towards survival versus being able to thrive on and off the field. So those are just a few of the impacts that this can have long term that can be really important for your athlete to be aware of. Now, what we can do, the first thing is education, knowing that these do exist and they exist pretty commonly in youth athletes. Educating on nutrition, whether it is at a point where the individual needs to see a nutritionist or if they are able to manage it with adjusting some of their protein, carbohydrate, even iron intake. The second thing we can do is introduce strength training early on. Usually between the ages of 12 to 15, it is recommended to start appropriately loading for that age group and teaching the proper technique. A lot of the time, high school and even college athletes have not done independent strength training, and they don't know how their form should look, what mechanics they should be using, and they're not prepared for the demand of the sport on their body because they haven't started actually introducing this higher load to allow for those adaptations for the muscle over time. The other thing that we can promote more is encouraging sport variety, especially for our youth athletes. Multi sport participation, it introduces a lot of variety of movements, and it helps kind of develop a well rounded athlete who can pivot between situations, and learns a lot more about the concept of sports and athletics rather than just success in one area. Another important factor that we can do is teach proper form early on. When we can adjust small mechanical errors that we know female athletes are more prone to than male athletes, we do often see improved performance and reduced risk for injuries. And then the last thing we can do is schedule rest. Planned recovery is important, not just physically, but also for mental recovery. Allowing our youth athletes to get a break from the pressures of the athletic world and take a break from the actual physical demands that these sports put on them. Now, where do we fit in with that? So, Better with Physical Therapy does actually offer a female athletic development program. This was designed specifically for 11 to 14-year-old female athletes, not only to educate them on injury prevention based on the principles of the female athlete, but also to provide a fun space to develop sport specific skills with their peers to improve their confidence and to instill a lifelong desire for an athletic lifestyle, because that is our overall goal, that this instills in our athletes a lot of principles of exercise and the role that it can play in our life rather than just striving to excel in the sport itself. I hope that this information was helpful. If you do have any questions about any of this, come on into Better with PT. We will have additional seminars on the female athlete. This one was more of a baseline information session to get some of the education out there. But we would love to hear any questions, any concerns, and give you more information to help your athletes succeed both on and off the field. Thank you.